Welcome to our discussion about the use of opiates in the management of chronic pain. This is our second discussion. In the use of opiates in managing chronic pain, we have to remember that there are basically two types of pain that we treat in chronic pain. One is called nociceptive pain, and this is pain that's related to pain such as arthritic pain or broken bone pain or pain associated with a surgery or abdominal pain. It's pain that does not involve nerves. The other type of pain involves pain that's generated from injury to the nervous system and is called neuropathic pain. Nociceptive pain is much more amenable to the use of opiates and is generally an easier type of pain to treat. Pain that involves the nervous system, so-called neuropathic pain, is much more difficult to treat, and oftentimes the use of opiates is only partially successful in treating this type of pain. Excellent examples of neuropathic pain include patients that have had spinal cord injury, patients that have had injury to nerves such as surgery, a lot of patients that have chronic sciatic pain that occurs after lumbar spine surgery also have elements of both nociceptive and neuropathic pain. In the past, neuropathic pain was really not treated with opiates because of the belief that neuropathic pain was refractory or not amenable to the use of opiates. However, we now know that neuropathic pain does respond, but only partially. In some patients, they have an excellent response to the use of opiates in neuropathic pain. Other patients require the addition of adjuvant agents such as anticonvulsants, anxiolytics, antidepressive agents. A common disease entity that I see is fibromyalgia, and it's commonly believed to be caused by unknown causes. I believe that fibromyalgia is really a type of chronic pain that is a neuropathic pain in that it involves abnormal processing of pain by the person's brain. Therefore, there's some type of change in the person's nervous system that makes them more susceptible to the perception of pain. So we have to remember the two basic types of pain: the nociceptive pain and the neuropathic pain. Oftentimes patients will have a combination of both types of pain. We also have to remember the difference between acute and chronic pain. Acute pain we're all familiar with. If you've ever broken a bone or had a cut or a burn, you're very familiar with acute pain. Chronic pain is completely different than acute pain. A lot of people think that chronic pain is just acute pain that goes on and on and on, such as pain that lasts for longer than 3 months. But nothing could be further from the truth. Chronic pain is definitely a completely different entity than acute pain, and it's not long-lasting acute pain. Chronic pain involves more of the psyche of the person and is much more difficult to treat and involves a completely different model of treatment. The model that we utilize in treating chronic pain is called the biopsychosocial model, and we'll be discussing that in a separate entity. It's very important for all of the patients to remember the different types of pain, and also to remember that opiates do not cure chronic pain. Opiates merely provide palliation and help to decrease the suffering associated with chronic pain. It does not cure chronic pain. We have to also remember that there are side effects associated with the use of opiates and that they only provide symptomatic relief. So those are some very vital points to remember in the use of opiates for managing chronic pain. And you can ask me, if I end up being your physician, what type of pain you have, and this will give you a good understanding of how much relief you can expect to obtain from the use of opiates in treating your chronic pain. I thank you for listening to this segment.